At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and platform, please leave us a comment in the comment section below. Imposter syndrome is a psychological phenomenon where individuals doubt their abilities and accomplishments and fear being exposed as a fraud despite external evidence of their competence. This condition is not officially recognized as a mental disorder by the DSM-5, but is acknowledged as a specific form of intellectual self-doubt. Imposter syndrome can affect anyone regardless of racial discrimination or their social status, work background, skill level, or degree of expertise. Here are some common characteristics of imposter syndrome. Chronic self-doubt and intellectual fraudulence. Individuals often dismiss their accomplishments as luck or timing and may believe their work must be perfect to be valued. Fear of being exposed as a fraud. There's a persistent worry that others will discover they are not as knowledgeable or competent as they appear. Overachievement. Those experiencing imposter syndrome may work harder to cover up their perceived lack of skills, which can lead to burnout. Inability to realistically assess skills and competence. They struggle to gauge their talents accurately and often undervalue their expertise. Sabotaging one's success. A pattern of undermining one's achievement or avoiding taking on new challenges due to fear of failure or being discovered as a fraud. Causes of imposter syndrome. Imposter syndrome does not arise in isolation but is often the product of a combination of personal and environmental factors. Family expectations. High family expectations can create a pressure cooker for individuals. Those who grew up in environments where success was highly emphasized or were frequently compared to siblings or peers might develop feelings of inadequacy that persist into adulthood. Academic and professional environments. Schools and workplaces that stress competition and constant evaluation can contribute significantly to imposter syndrome, particularly in high-stakes academic or professional settings. Personality traits. Certain personality traits such as perfectionism and neuroticism are closely linked to imposter syndrome. Perfectionists, for instance, set excessively high goals for themselves, and when they fail to meet these goals, they feel like imposters. Neurotic individuals may be more prone to anxiety and depressive symptoms, which can exacerbate feelings of inadequacy. Cultural factors. Cultural background can also influence the prevalence of imposter syndrome. In cultures where humility is greatly valued and self-promotion discouraged, individuals may feel like frauds when they receive recognition or advancement. Minority status. Being part of a minority group in a predominantly different culture or workplace can heighten feelings of being an outsider and by extension intensify imposter syndrome symptoms. To learn more about imposter syndrome, go to our Carepatron website or click on the link in the description. We have a range of guides and articles to help you learn more about different therapy techniques to incorporate into your practice. Carepatron is a healthcare platform designed for you. Signing up is free. Just click on the link in the description. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.